Doctors at all levels of training have the right to feel safe and supported at work. A large part of this is down to the supervision they receive. It's important that doctors in training work within an environment that helps them to learn, develop, and be the best doctor they can be. Every day at work, doctors in training need some level of supervision. Workplace supervision can be provided by anyone competent to carry out the task in question: doctors, nurses, and pharmacists, amongst others. This is David. As a foundation doctor, he needs direct physical access to someone who can help with tasks that he is not confident with. Post-foundation doctors need less direct workplace supervision, but also must know who to approach if they have a clinical problem. This is Mandy, the consultant on call today. As clinical supervisor, she has overall responsibility for the patients trainees are caring for. Every trainee must know who their clinical supervisor is on each shift. When David arrived at his new clinical placement, he was introduced to his named clinical supervisor, Ravi. Ravi is David's go-to person if he has concerns about the clinical experience he is getting. When David worried about not seeing enough new patients to achieve his competencies, he spoke to Ravi, who arranged for him to spend more time on AMU. David's educational supervisor is Jess. She has an overview of his training. Jess helps David try to achieve his professional and personal goals. In a safe and supportive environment, they discuss anything related to being a doctor. Sometimes a trainee has personal difficulties that they don't want to discuss with their educational supervisor. Departments must make sure that trainees know who they can go to for support with a personal issue. To learn more about how Health Education England, the CQC and NHS Improvement are working together to make sure you get the best supervision, visit hee.nhs.uk/enhancing-supervision.